I'm a licensed pediatric psychologist. Of course I have favorite patients, but maybe not in the way that you think. Hi, I'm Dr. Julia. I'm a licensed pediatric psychologist that works in a hospital setting with children and teenagers and young adults. And you might think that we would just love patients that like either fit our personality or maybe follow all of our recommendations immediately, but honestly, that's not necessarily true. I think, yes, a lot of times we love working with families that, we have a same sense of humor or we like really get each other. But honestly, that is not necessary for a strong therapeutic relationship or alliance. Some of my favorite patients actually really push back on my recommendations. They're like, how? Why? Explain that to me. Explain the science behind it. I want to understand. So even if we're not like mushy-gushy, that does not mean that I do not enjoy working with that family. We all have different personalities and we all love different families that we work with in different ways. And honestly, it's important for me as a provider to be able to change the way I approach our treatment based on what you're kind of putting down, right? I cannot just use the exact same approach with every family. That would not be very helpful. Now, the research doesn't change, right? So like I will always use the most evidence-based care, but I usually am flexible and can adapt to your needs as needed. The only times where like I'll state to the family that maybe we're not a good fit is if we've done some work together, or even if after the first session I explain of like, this is the type of treatment I do. I'm not sure that that is what you're looking for. I just try to be very upfront about it. I do not take it personally. Also, if you don't feel like you vibe with me or don't mesh with me, another thing I don't take personally, I will always refer to somebody who I think might be a better fit. And again, that's not something that I take personally. I know how LOL, personal therapy can be, right? And so it is important that you trust your provider, even if like maybe you're not like touchy-feely with them. As long as you trust your provider, I think that is where that therapeutic relationship really thrives. And if you're a mental health provider or another medical provider, do you have favorite patients? What are some of your favorite families to work with?